Mariano, your group is discussing traditional diagnostic procedures. So which are the standards, the current standards, with respect to the latest classification?
Well, the current standards to diagnose a patient, of course, is first the patient. So we need a thorough medical history and an evaluation of the patient's risk factors. But then clearly we need to have a periodontal examination, and the periodontal examination today is based mainly on clinical probing of all the teeth in his or her mouth. But in order to stage and grade the patient, if the patient has periodontitis, we need to further supplement the clinical examination with radiographs. Basically today, the standard of oral radiography are 2D images, tooth by tooth, so we have a very fair representation of all the teeth in the patient's mouth. However, I will reiterate, radiography only comes if we diagnose the patient clinically as having periodontitis.
I think this is a very important sentence. So Ian, traditional diagnostic procedures or tools, they have drawbacks. And which drawbacks do you see, and how do you think novel technologies or other techniques can overcome these drawbacks?
One of the biggest drawbacks, I think, with current diagnostic tools for periodontitis is that they tend to pick up the disease late. And so, as Mariano has alluded to, we still have the periodontal probe as the main method for diagnosing periodontitis, but periodontitis has complex signs. It's not just a single sign. You measure bleeding, you measure probing depths, you look at attachment levels and bone loss, etc. And so quite often that can only be done by somebody who is skilled and trained, i.e. an oral healthcare professional, mostly dentists, and it's not amenable to the big part of the population that doesn't attend a dental practice on a regular basis. So we need techniques and methods that will allow non-dental professionals to start detecting cases early, and then they can refer for formal diagnosis to the dental teams. But we also need methods that are going to be able to detect the disease at a much earlier stage. And this is one of the advantages actually of the staging and grading system in that stage 1 is picking up very, very early disease. Arguably some people say too early, but we would rather it was too early than later. And the other thing that the classification allows us to do is to incorporate in the future biomarkers. So biomarkers in saliva, for example, that may give us an indication that there is incipient disease or the disease is just starting to develop. And that will then help us to intervene earlier and prevent the disease from progressing.
Thank you.